Good morning, good afternoon, good evening, depending on where you're watching me. My 32nd episode. And today I'm going to talk about the Cancer Health Fund. In my last episode, I talked about, you know, getting, interventions by the federal government that helps with the cost for cancer treatment because cancer treatment is very, very expensive. So, in my last video, I talked about registering for the NHIS, which is the National Health Insurance Scheme, which has been changed currently to the National Health Insurance Authority. So, I advise that any diagnosed or even when you're not diagnosed, please do register for this insurance and make your contribution annually. It goes a long way in helping to access cancer care. And so today I'm going to talk about another intervention with the federal government. And I need to say this fund is called the Cancer Health Fund. It started out as Catastrophic Health Fund. Then later it was called the Cancer Health Fund, CHF. But currently the federal government is trying to rename it to the National Cancer Health Fund. So about this fund, it is the fund appropriated from the National Assembly, the legislators, to cater for indigent cancer patients, patients that cannot afford care and who are not on insurance, or even if they are on insurance, maybe their HMO cannot even cover much. So this fund is meant for them. And this fund currently is domiciled in six hospitals in Nigeria, in each of the geopolitical zones. And so we have the UNTH Enugu, National Hospital Abuja, UCH Ibadan, University Teaching Hospital Gombe. I think there's one in Zaria, and then UBTH for the South South. And this fund is domiciled in these hospitals. And so when you get to these hospitals to access care, you have to apply online. Currently they have some of their staff there, sitting there permanently, and this is to cater for the indigent patients that are not online. They cannot do anything online, so those staff will help you to apply online. And when you have applied, they will send your request to the app for approval. And when the approval comes, you will be able, sometimes they can credit your wallet with 1 million, 2 million, 3 million, depending on what they think or how your treatment is going. And so one good thing about this fund is that it helps you to start. It helps you to access all the cares around oncology inside that same hospital, the consultation, the scans, everything. The only disadvantage is that if there is any care that particular fund is not covering, you need to go outside and do it, and you pay out of pocket. So but for a lot of other things the funds cover, even chemotherapy medications. So this is a very good fund. Why am I bringing up all these things? I am letting you know so that when one is diagnosed, or you're diagnosed, or somebody else is diagnosed, you can advise that person at rightly to go to so hospital. For now I'm told that they are trying to widen it up to other hospitals, but for now this is where it is working. So you advise the person, in spite of the fact that you are not financially capable of taking care of this your treatment, you can go to these hospitals and access care free of charge. It is not perfect yet. It is a work in progress. And by God's grace, it will continue being a work in progress. And I need to give honor to whom honor is due, because the people that went and lobbied for this one is the Health Federation of Nigeria. As at 2019, that was when they lobbied for these funds. And when the funds, then it when the Health Federation of Nigeria was led by Ms. Claire Omaseye, and I was the patient. I and Sarah Yu, who were the patients, the cancer patients that for accompanied them and shared our experiences to advocate for this fund to be established. And God so kind, and thanks for the federal government, they put it into the budget. And so these funds are appropriated every year, so cancer patients can make use of it. So I am putting all these things out there to help, especially cancer patients in Nigeria. Please don't be at home and say, I don't have money. Go out, go to the hospital and start your treatment first. Search, you will find all these things, please, because cancer diagnosis is not a child's play. And when this happens, you need everything to fight it. And so please don't give up on yourself, because there are some interventions that could help you. Please, that is why I am doing this video. And so in my next video, I'm going to still bring up another topic. Watch out for that. Thank you.